The Hyperbaric Oxygen Therapy Program at McLaren Regional Medical Center provides healing relief to patients with chronic wounds due to diabetes and poor circulation, as well as patients who are experiencing difficulty with bone or soft tissue healing as a result of radiation therapy. The program is part of McLaren's Wound Care Clinic, serving patients with chronic wounds since 2005. Hyperbaric oxygen therapy is a safe, non-invasive medical treatment that can provide significant healing results. Healing is achieved by delivering pressurized 100% oxygen to the entire body. This pressurized environment forces more oxygen to dissolve into the bloodstream to reach a wound or area of poor circulation more effectively. Once inside the hyperbaric chamber, the patient breathes 100% oxygen, while the pressure of the chamber is slowly increased above atmospheric pressure. The increased pressure allows oxygen to better reach bone and tissue, encouraging increased activity of white blood cells and the creation of new peripheral and capillary vessels, helping the body begin to heal itself. Dr. Musa Hafaji, a certified plastic surgeon specializing in wound care and hyperbaric medicine, provides medical direction for the Wound Care and Hyperbaric Oxygen Therapy Program.
We learned that the way we use gases that we breathe in is to convert it into very tiny bubbles of gas. And then that passes through the thin wall of the lung and the thin wall of the blood vessel, and that gets into the system. And that's used as a bubble when it gets to the cells. We found that we can impart some energy to that so that it travels further across from the lung to the blood vessel. It has more energy to it in stimulating blood cells that are very important in treating infections. The white blood cell particularly has the ability to ingest bacteria and debris. And this, that we refer to as killability, is increased 2 to 3 times by the use of this hyperbaric oxygen.
Prior to the start of treatment, vital signs are taken, and the patient changes into a gown and pants designed for use in the hyperbaric oxygen chamber. For diabetic patients, blood sugar levels are checked both before and after treatment. Once all pre-treatment assessment has been completed, the patient lies on a treatment stretcher and is wheeled into the hyperbaric chamber. There are 3 phases of hyperbaric treatment: compression, treatment time, and decompression. During the phases of hyperbaric treatment, a patient experiences changes in ear pressure similar to that felt on an airplane. The staff monitors ear pressure and patient comfort continually throughout the entire treatment program. The wound care physician may prescribe a course of treatment between 30 and 40 sessions. Treatments generally range from 60 to 120 minutes, 5 days per week. Depending on patient response, the physician may adjust this treatment schedule. Every effort is made to provide education and support to the patient as treatment begins. Patients are encouraged to bring in their favorite DVDs or watch television during the treatment session.
I had a wound in my left foot, and it was very deep, and eventually was diagnosed with osteomyelitis, so it had gone to the bone. And during that treatment, Dr. Hafaji here at the Wound Care Center said that I was a good candidate for hyperbaric treatment, and that it would really help with the healing of the wound and the bone in particular.
I came to the therapy program through Dr. Williams, the foot doctor here. He thought that the wound on my big toe and the osteomyelitis in the big left toe would be benefited in the healing process by the oxygen therapy.
The wound began to heal much more rapidly. The bone, when they x-rayed it, showed that it had developed a callus, extra bone around the area that had been the wound in the bone itself. And the x-ray doctor had written, and Dr. Hafaji mentioned this, that it had exuberant bone growth around it, so it did great.
Right now it's all healed. It doesn't need any further treatment, according to Dr. Williams, so I'm real happy.
Hyperbaric oxygen therapy is a proven, successful therapy for many conditions causing wounds, infections, and bone weakness. Treatment is covered by Medicare, most managed care, and private insurances. Our staff will verify benefit coverage and assist in obtaining authorizations, as well as preparing patients to begin treatment.
Because of the success of so many of these hard-to-treat problems, I would encourage the doctors to contact us, to send their patients in us to see if we can be of help with these very difficult situations.
I definitely would recommend it because of the increased healing and the preventive effect that it has with allowing the bone to heal and not have a reoccurrence a year or two later.
I would recommend McLaren's hyperbaric oxygen chamber therapy to anybody.
McLaren's Hyperbaric Oxygen Therapy Program and Wound Care Clinic is your partner in healing. Call us to request more information about hyperbaric oxygen therapy and how this unique treatment can help those with chronic wounds get back to healing.